So with continued growth, coalescence of plexiform meanings preotima leads to formation of future dural sinuses, development of basal ganglion, and then other deep structures leads to the emergence of paired internal cerebral venous system. Tremendous growth of neopalaeal, that is the highly evolutionized cortex, leads to the emergence of venous channels like Rolando, Trollard, Labbe, and then superficial sylvian veins. So coming to the developmental stages, when here we see a picture depicting a 28-year-old 28-day-old fetus. So the crown rump length is 5 millimeters. So crown rump length is the length of from the cranial to cauda in the straightest possible position of the embryo. So at this point of development, you can see the meninx privativa coalesce into different forms leading to the anterior plexus, middle plexus, and posterior plexus. So all these plexi again drain into the primary head sinus. The brain, so this and also keep a note on this primary maxillary vein, which also starts developing at this stage. So this primitive maxillary vein, which develops during this stage, ultimately leads to the formation of the cavernous sinus. So at 36 days of gestation, when the crown rump length is about 10 millimeters, the telencephalon is still under development. However, you can see the primitive telencephalic vein is developing here, and also primitive maxillary vein, which I've already told that it leads to the formation of cavernous sinus. So the entire draining system is directed towards the primary head sinus. So next, when the fetus is about 48 day old, so when the length of the fetus is about 18 millimeters, so this is the age at which the aortic vesicle starts developing and starts becoming a barrier between the internal jugular vein and then stem of the mid-dural plexus and then primary head sinus. So when the barrier forms like this, so it gives ways to the formation of the sigmoid sinus here. Which forms as a secondary anastomosis, leading to between the marginal and developing transverse sinus and jugular vein. And then this is at this stage, we can also see the midline developing venous midline structures. So the dominant marginal sinuses, which drain into the sagittal plexus, and also the tentorial plexus, which are well visible, which drain posteriorly. And developing a choroid plexus is also seen, which leads to emergence of deep venous system. So at the 53-day development, that is almost like 7 weeks of development, we can see there is marked growth of the choroid plexus, and it establishes the venous connections with the primary head sinus and other venous system. So during this stage only, there is an emerging vein known as primitive vein of Markowski, which connects the plexus to the developing superior sagittal sinus. So this is the vein, and the true internal cerebral veins also develop from these veins. And also we can notice that the vein of Galen develops due to the high flow state, which persists in the vein of Markowski. And this is another source of drainage of choroidal plexus, which are mainly dorsal and ventral diencephalic veins, which drain the choroidal plexus into marginal and tentorial sinus respectively. So the basal vein area is mainly drained by dorsal and ventral diencephalic veins. However, it is very late to form. And at the stage of 11 weeks, this is marked by the end of the first trimester, where we can see the marked development of near venous system. So we can see the superior sagittal sinuses forming, and the basal cerebral vein, which is still in formation, which is the last one to form. And at this stage, it depends upon this stage where a lot of variations in the basal vein is also seen. And typically the basal vein, it's basically a conduit between the cavernous sinus, and the vein of Galen. So this is a picture depicting about the basal vein. You can see the basal vein here with the purple and pink arrows. So it forms a connection between the cavernous sinus and to the deep venous system, that is to the vein of Galen. So coming to the venous system, so the main venous system is divided into superficial and deep groups. The superficial groups mainly drain the cortical surfaces, and the deep groups mainly drain the deep white and gray matter and through the walls of the ventricles and basal systems to drain into the internal cerebral, basal, and great veins. So mainly the superficial venous system is formed by three groups, that is the superficial cerebral veins, middle cerebral veins, and then the posterior cerebral veins. Here also we can see the anastomotic veins, that is vein of Trollard, and also Sylvian veins, and also vein of Labbe, which interconnect the sinuses. So superficial cerebral veins, they are mainly 8 to 12 in number. They mainly drain the superolateral and medial surface, and they ascend upward into the arachnoid matter, and then into the subdural space, and then superior sagittal sinus. Middle cerebral veins are mainly 4 in number, 2 on each side. They are mainly superficial middle cerebral vein and deep middle cerebral veins. So the superficial middle cerebral vein lies in the lateral sulci, and then anatomically drains into the cavernous sinus. It communicates posteriorly with the superior sagittal sinus through the superior anastomotic vein, and with the transverse sinus with inferior anastomotic veins. The deep middle cerebral vein mainly lies in the lateral sulci, so joins the anterior cerebral vein to form the basal vein, which ultimately drains into the vein of Galen. So inferior cerebral veins mainly drain the inferior surface, lower parts of the medial and superior lateral surfaces of the brain. And vein of Trollard is a large posterior frontal vein, usually situated in the postcentral sulci. It drains into mainly superior sagittal sinus. The Labbe is the largest vein draining the temporal convexity towards the transverse or sigmoid sinus. Superficial Sylvian vein collects tributaries from the region of operculum and adjacent cortex and has a variable pattern of drainage. These anastomotic veins, the Trollard, Labbe, and superficial Sylvian, they vary in domination. When one is dominant, usually other will be hypoplastic, or sometimes all three can be co-dominant also. So this is a balanced pattern where in this picture you can see the vein of Trollard in the superior aspect, and in the lateral aspect over the temporal region you can see the Sylvian veins, and posteriorly you can see the vein of Labbe, which are interconnected. So this is another anatomical variation where you can see a dominant vein of Trollard, and which actually is also having anastomosis and connections up to the petrosal and then the cavernous sinuses also. And if you notice here, the vein of Labbe is slightly hypoplastic also. And in this picture, this is another anatomical variation where you can see a dominant vein of Labbe here, and then you can see the vein of Trollard a little hypoplastic. Here usually the Labbe is quite dominant, and we can also notice this. So draining into the lateral sulci, lateral sinus. And pseudo-Labbe dominance is another anatomical variation where the temporo-occipital vein appears appears like Labbe, but in fact it is not, and mainly collects from the Sylvian area and also convex territory over the region. And also, if we can notice that the cavernous sinus and the petrosal sinuses are hypoplastic in this condition. So dominant Rolando is another anatomical variant. Vein of Rolando is mainly situated in the Rolandic fissure. So in this picture, we can clearly see the dominance of the vein, and the vein of Trollard being a little hypoplastic. And in the right picture, we can see the dominant sylvian veins, which mainly drain into the petrosal and the cavernous sinuses. So this is another anatomical variant where you can see the discontinuous pattern of the sylvian vein with the cavernous sinus drainage. So this sylvian vein mainly drains into the spinoparietal sinus and subsequently in the cavernous sinus. So if we can also notice a little more closely, you can see the coiling here, which was done for this patient. So coiling, aneurysmal coiling. Next, coming to the deep venous system. The deep venous system mainly consists of internal cerebral vein and basal vein of rosenthal. So internal cerebral vein is one of the first veins to form early, and it has least interconnections. Thrombosis of this vein can be quite devastating because of poor collaterals, and mainly drains the structures adjacent to the ventricles, and it mainly has medial and lateral groups. So the internal cerebral vein, so it mainly drains the structures adjacent to the ventricles. So the names which are underlined in the green represent the lateral part, lateral root, and veins which are underlined with the purple represent the medial. So mainly the lateral group represent the caudate veins, thalamostriate veins, and then lateral direct veins, whereas the medial group represents mainly the median veins of the lateral ventricle and the septal veins. So this is a picture depicting the internal cerebral venous system. So where we can see the septal veins which run medially, and we can see the caudate veins. These are the lateral groups. They are mainly divided into transverse and longitudinal based on their course. So we can see the caudal veins which run horizontally are named as transverse, and then which run vertically or longitudinally, they're named as longitudinal caudate veins. And then comes the thalamostriate veins, and also veins which drain the caudate nucleus. So there is another approach for the internal deep venous system. So this is called as a Lasjaunias approach. So Lasjaunias approach is mainly there it gives an insight into the anatomical variations of the internal cerebral venous system. So here Lasjaunias has divided the internal venous system, internal cerebral venous system into mainly two types, that is the inner ring and outer ring groups. So the inner ring groups so mainly consists of internal cerebral and basal veins, and then the outer ring is made up of longitudinal veins of caudate and the veins that drain the lateral ventricle. And these rings are mainly useful in explaining the variations, which are essentially the interruptions. So if you can see, if there is any interruptions in these veins connecting the outer and inner rings, so the venous flow will be rerouted to the other connections. So based on this theory, multiple variations can be seen in the internal cerebral venous system. So in this group, so mainly the veins include thalamostriate, caudate, and septal veins and atrial veins. So the thalamostriate veins mainly, even though the name is about the thalamostriate, they mainly drain the caudate and adjacent white matter. And the caudate veins, as I already explained in the previous slide, so they are divided into longitudinal and then transverse veins based on their course. So the transverse veins are part of deep medullary or deep white matter system, whereas longitudinal caudal venous artery forms the outer ring. And here, so we can see the lateral direct veins. So the one with the black arrow are the lateral direct veins, which collect from the territory of the posterior caudate and the near lateral ventricular surface, whereas the ones which are pointed out by the white arrows are the medial atrial veins, which drain a little more posteriorly and medially. coming to the basal vein of rosenthal, so it is mainly formed by the union of three veins. So it mainly has three components, that is anterior segment, deep middle, and then the straight veins. So the basal vein of rosenthal along with the internal cerebral veins join to form the great vein of Galen, and then which ultimately drains into the straight sinus. So here is the angiographic picture showing the basal vein of rosenthal. So it is mainly shown by the blue arrows here, the dark blue arrows. So it joins with the internal cerebral veins, which is depicted by the red arrows, and ultimately form the deep vein of Galen, and then drain into the straight sinus. So one more thing is, the basal vein, as I already explained, so it mainly forms a conduit between the cavernous sinus to meet the internal cerebral veins. And then it has three segments, that is the anterior, middle, and posterior segment. So these segments are represented by its course. So the anterior segment extends from the cavernous segment till the basal systems, whereas the middle segment curves around the midbrain, that is the mesencephalon, whereas the posterior segment extends from the midbrain till the vein of Galen. So these three segments are important in the anatomical variations because either one, any one of the segments can be hypoplastic, leading to other segments being dominant. So in this picture, we can see the discontinued basal vein. So as we know, the three segments of the basal veins which are there. So we can see the middle segment being hypoplastic, and the anterior and posterior segments draining independently. So the anterior here mainly draining into the petrosal sinuses and cavernous sinus, posterior draining into the vein of Galen. And here we can see the three segments which are not which are not connected directly. So the main anterior segment drains into the cavernous sinus, whereas the middle segment drains into the lateral mesencephalic vein, whereas the posterior segment drains into the vein of Galen. So here we can see another variation where the posterior segment is slightly hypoplastic, and the anterior hypoplastic, and then the anterior segment is quite dominant, which actually drains into the cavernous and petrosal sinuses. So in this we can see it as another variant, which is the large basal vein, and we can see here the cavernous sinuses and the petrosal sinuses are not seen. So they are hypoplastic in this case. So on both sides, the superficial these veins drain along with the superficial venous system, the sylvian venous system, and then making it looking pretty enormous. So this is another variant where the basal vein mainly drains into the lateral mesencephalic vein rather than going into the vein of Galen, and then ultimately draining into the tentorial sinuses. Next, coming to the vein of Galen. So basically it's approximately 2 centimeter in length. It is mainly formed by the union of internal cerebral veins and then the basal vein. The vein of Galen ultimately drains into the straight sinus. So the pathophysiological importance of Galen is mainly to recognize its absence in case of congenital arteriovenous shunts into the deep venous system. So usually when the vein of Galen malformation picture is there, so we need to assess whether the vein is really present or not. So in case of AV malformations which form during the congenital stage, so the shunt is developmental shunt is present, which directs the vein flow to other systems, venous training systems, making the Galen and straight sinus not to develop at all. So this is the true variant of the vein of Galen. So in the sense, the true variation of the vein of Galen is nothing but the absence of Galen, which has happened during the developmental stage itself. If in case if the vein of Galen is seen along with the AV malformations, then it depicts that this damage or whatever malformation has happened, it has not happened during the congenital stage. So in the true congenital Galen malformation, the Galen itself and the straight sinus will be missing. So in this picture, we can see the AV malformations, and then we can see the vein of Galen is not there. Instead, there is another venous system here draining. This is also known as false Galen or false Galen, which gives a picture like which imitates like a vein of Galen. Coming to the dural sinuses and veins, the dural sinuses receive cerebral veins from the superficial and deep venous system. So they lie between the outer and inner layers of the dura mater. They don't have any walls. So the most important sinuses in the brain, they include superior and inferior sagittal sinus, straight sinus, transverse sinus, sigmoid sinus, cavernous sinus, and petrosal sinus. So here we can see the superior sagittal sinus. So in this picture, in fact, we can see the anterior segment of the superior sagittal sinus is hypoplastic. This is one of the variants of the superior sagittal sinus. Coming to the normal course of the superior sagittal sinus, it's mainly attached to the falx cerebri, ends with the crista galli. So crista galli is mainly a thick and midline structure arising from the superior surface of the ethmoid bone. And in about 60% of cases, superior sagittal sinus ends by becoming the right transverse sinus. And at the termination of a superior sagittal sinus is the dilatation known as confluence of sinuses that I'll show in the coming slides. It is also known as torcula hierophili, named after the Greek philosopher. And then the superior sagittal sinus also communicates with veins in the scalp through emissary veins that pass through the parietal foramen. And so here is a clear picture showing the dural sinuses. So we can see the sickle shape of the superior sagittal sinus. So mainly we can also see the trolloid vein draining into the superior sagittal system and also superficial veins. And then it starts from the crista galli and ends till the torcula heterophilic, so known as confluence of sinuses. So inferiorly, actually here inferior sagittal sinus is not seen. So inferior sagittal is another sickle shaped sinus seen in the inferior of the superior sagittal sinus. And then here comes so mainly it occupies the posterior 2/3 of the free inferior edge of falx cerebri. So it ends by joining the great cerebral vein to form the straight sinus. And the straight sinus is formed by the union of inferior sagittal sinus with great sinus. It is attached to the tentorium cerebelli. It may drain into either transverse sinus most commonly, or sometimes into the either transverse sinus or sometimes into the left transverse sinus. And coming to the transverse sinus, they usually pass laterally from the confluence of the sinuses in the attached border of tentorium cerebelli. So coming to the anatomical variations, almost 39% of the cases are hypoplastic on left side, and 20% of aplasia can be seen on the left side, and 31% of the cases will be codominant or symmetric. So, most of the patients, we can see the left transverse sinus being hypoplastic, and most of the people getting confused it as a thrombosis, venous sinus thrombosis, but in fact it will be hypoplastic. And the right transverse sinus usually will be dominant and larger and receives majority of the drainage from the superior sagittal sinus and receives blood from the superficial part of the brain. Whereas left transverse sinus and left it drains into it's almost hypoplastic in some of the cases, and along with left sigmoid sinus drains into the left internal jugular vein, and mainly receives the blood from deep parts of the brain. and from the internal cerebral basal veins. And we can see the S-shaped sigmoid sinus here, which drain into the internal jugular veins. So it's basically the continuation of the transverse sinus, and it passes inferiorly and medially into the jugular foramen and ultimately drains into the internal jugular vein. So next comes the cavernous sinus. There are mainly two large sinuses, about 2 centimeters long and 1 centimeter wide. They are mainly located on each side of cellular tuxica and body of the sphenoid bone. And many trabeculae are present in these sinuses, and they contain the blood channels. So each cavernous sinus receives blood from the superior and inferior ophthalmic veins, and superior middle cerebral vein into the lateral fissure of the and the superior middle cerebral vein. So anatomically, we should also know the most important structures that pass through this sinus. So within the sinus, it is the internal, medially it will be the internal carotid artery and the sixth cranial nerve, and laterally from top to bottom. So third nerve, fourth ophthalmic segment of the trigeminal and maxillary segment of the trigeminal will be present. So where in the cavernous sinus thrombosis we can see multicranial nerve palsies also. And coming to the superior petrosal sinus, it extends from cavernous sinus to the junction of transverse and then sigmoid sinus, and receives tributaries mainly from the pons medulla, cerebellum, and inner ear. Inferior petrosal sinus passes between the glossopharyngeal and vagal and drains into internal jugular vein also after exiting through jugular foramen. So it mainly drains the inferior portion of cerebellum and also receives from the cavernous sinus into the internal jugular vein. So coming to the torculoheterophyllae, this is also known as confluence of sinuses. So it is mainly formed by the confluence of superior sagittal sinus, straight sinuses, occipital sinus, and transverse sinuses. So this anatomy is highly variable, and three types can be distinguished. So in the first type where the superior sagittal sinus is dominant and drains in one of the lateral sinus and straight sinus into the other with no connection between the two. And type 2 where superior sagittal sinus and straight sinus form and the forks from both sinuses join to form the lateral sinuses. And type 3 is mainly the true confluence of all the sinuses. So this is about the venous anatomy and anatomical variations.